And while we deal with the growing emergency here at home, for many, the crisis is already in full swing. The most active hotspot right now is Italy. Nearly 200 people there have died in just the last 24 hours. Airports have been empty for several days, and now all stores except for pharmacies and food markets will be closed. Take a look at this. St. Peter's Square at the Vatican empty as the country with the highest death rate grapples with getting the spread under control. All this as a doctor on the front lines is issuing an alarming warning for his counterparts in America. ABC's Maggie Rulli is tracking the latest from London, where a health official there has announced they have COVID-19.
Life in Italy has officially crawled to a halt. People are finally taking the country's lockdown seriously. It took a televised plea from Prime Minister Conte to protect Italy's older population.
Un'Italia zona protetta.
The country hit with an alarming rate of infection that's been difficult to contain. More than 2,300 new cases of COVID-19 in just the past 24 hours, bringing the number infected to more than 12,000 and claiming the lives of 827. Its healthcare system strained so badly, medical professionals fear resources may run out.
We need to shut down everything. Here, it was like a bomb. It exploded, and all of a sudden, you are overwhelmed by the patient.
Italy's government's heeding the calls. Everything but food markets and pharmacies are shutting down. Signs of a strained economy are palatable. ABC's Megan Williams is in Rome, where businesses were struggling to survive even before the total lockdown.
Just standing at my local pizzeria. Sandro, who's the pizzaiolo, the guy who makes the pizza, says that he has one more day probably to go like this. He's only had one client, and then he's going to close. That it's just not sustainable to keep his business open.
Food shopping is the last sense of normalcy people have here.
People are not hoarding the way they are in North America. People have smaller homes. They also have different habits. They go shopping every day, and for now, people are keeping those habits.
But fear is almost as contagious as the virus itself. The World Health Organization declaring COVID-19 a pandemic.
It will be a tsunami. It will be eating all the country unless you take immediate actions. Otherwise, it will be too little and too late.
Nations with infections scrambling to test, treat, quarantine. In the UK, store shelves left empty as shoppers race for the last rolls of toilet paper and pasta. Nearly everyone we've met coming in and out of the supermarket says they are here to stock up on supplies. One woman says 48 hours ago, she didn't really think about it. Now, with all of this new news coming out, the new numbers, she is worried. She has 4 little kids she's worried about. Another man says he has a 3-year-old at home. He wants to make sure she stays safe. He's been to 4 other supermarkets, 0 toilet paper. And even though Europe's open borders are tightening, it may be too late to keep the rate of infection low everywhere else. UK's health minister announced last night she too was infected with the virus, tweeting, "More worried about my 84-year-old mum who is staying with me and began with the cough today. She's being tested tomorrow." China's lockdown measures seem to have worked. Infections there are dropping, but only after a month of keeping millions under strict quarantine. But Italy and other countries don't have the luxury of time to save their aging populations.
And Maggie Rulli joins us now. Maggie, the situation for many on the ground in Italy is just gut-wrenching. The healthcare system there is just extremely strained.
Lindsay, gut-wrenching is a perfect way to describe it. The reports we are hearing on the ground, they're almost hard to believe at this point. It really is being described as an entire healthcare system that is on the very brink of collapse. You know, many doctors there are saying they now are having to approach patients almost like wartime triage. They're having to make very difficult life or death decisions. We know they're very low on ventilators right now. The government is already talking about that triage situation, having to prioritize how they are going to save the most number of people, and it's looking like they may have to prioritize young, healthy people, which, Lindsay, we know that could mean that could be to the detriment of people that have pre-existing conditions. I mean, there's even talk now of putting an age limit on who gets ventilators at some of these hard-hit hospitals, potentially an age limit of as young as 60 years old. I mean, that's like people's parents, people's grandparents. I mean, these are emotional times, not only for people in Italy, but for the doctors and nurses that are on the front lines, having to make these difficult decisions. Again, describing it as almost like a wartime in some of these hospitals. Lindsay, it's just hard to believe.
You're right. And Maggie, we heard from that doctor, and you've also traveled to some of those hot zones in Asia yourself. Should Italy be a warning to the U.S.?
Lindsay, this is really the big takeaway right now. Many infectious disease experts are saying that places like the UK, like the US, they're just 2 to 3 weeks out from becoming Italy. You know, I was in Italy a little over a month ago when they had one of their first scares, and to see what has happened to that country in, 5 to 6 weeks since then, it's unbelievable. There is no other word to describe it. People kept saying, how could it happen here in Europe? And that's what's fueling this fear here throughout the country. Which country is going to be next? But we also were in Japan recently and other countries in Asia. And when I was in Japan, what I noticed was that so many people were taking this incredibly seriously, already practicing things like social distancing and self-isolation, as well as, sort of a very proper self-hygiene as well. And we've seen some of the cases in places in Asia plateau or even start to decline. Many experts are crediting these services that people are doing. So if there's any major takeaway that we can learn from these other countries, it's now is the time to act. Now is the time to take it seriously before it gets as bad as places like Italy. Lindsay?
Right. Okay. Our Maggie really reporting from London for us tonight. Maggie, thanks so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.